Hello everyone, this is Dr. Shawn Pourgol, the Traveling Osteopath, and today I want to speak with you about 3 common complaints patients have about manual osteopaths. But first of all, I want to give thanks to God. Thank you, God, for this beautiful day. It's 25 degrees. Just last week we had the snow here in Canada, and now it's 25 degrees and I can get to enjoy outdoors, listening to the birds. You hear them? It's beautiful. Nature is so beautiful, and I'm grateful for God to keep me alive to see this beauty. And yesterday I also heard many of the airlines opened. I'm very happy about that. Soon my nickname from Traveling Osteopath would have been Pastry Osteopath, because all I'm doing these days is cooking and baking at home. As I always said, I knew humanity and science will overcome this health crisis, the COVID-19, and it seems like that many of the businesses reopened and the rest will reopen soon, so I'm very happy about that. Now, I want to speak about some common complaints patients have about manual osteopathy, but before I do so, I own 3 schools of osteopathy: National Academy of Osteopathy in Canada, National University of Medical Sciences in USA, which is the first and only school of manual osteopathy in the United States, and National University of Medical Sciences in Spain. I also registered National University of Medical Sciences Panama to teach Spanish language osteopathy related courses there, but that's not open. I also founded the Osteopathic Chronic Pain Clinics of Canada, which now has 333 locations in 30 countries. I love osteopathy. Osteopathy is my life, but every time I speak about some problems that the profession have, I get criticized by my students, by others. They ask me why you speak about negative things about the profession. It is not because I don't love the profession. Osteopathy is my life. I breathe osteopathy, I live osteopathy. My goal in life is to ensure every town with a population of 100,000 people have at least one manual osteopath in it. I expanded osteopathy to 72 countries, and it is my life. But we cannot just close our eyes like what quail does when it sees a predator, hides his head under the snow and hopes the predator doesn't see it. We shouldn't do that. We have to speak about the bad parts of the profession, the negative parts, because that is how it gets improved. I remember before I became a manual osteopath, I studied chiropractic, and at that time that theory that they had over 25 years ago, 25 to 30 years ago, the subluxation theory, which they talked about bone out of place that affects the nervous system, and it didn't make sense. Bones cannot simply go out of place unless it gets a major trauma to it. So by simple day-to-day things, it's very rare that it happens. And that subluxation theory didn't make sense to me, but when I spoke about it, everybody criticized me. They said, why are you speaking bad about this theory? Then you should have studied medicine. Why you studied chiropractic? It's not that. Now, that theory of subluxation is not accepted now. Instead of bone out of place, they say it's a lack of motion restriction, that motion that causes a subluxation. So they don't follow that bone out of place theory anymore. The same with osteopathy. I feel there are things that can be improved, and by speaking about it, by making dialogue, the whole profession improves. I'm a scientist, and I don't attach myself to a certain belief. I don't get fixated on a certain belief because somebody said that's supposed to be like that many years ago. If science proves something new, I follow that. I keep my brain open, my mind open to accept new possibilities and not to accept something blindly because somebody said so over 140 years ago. Things change, science shows new things, and that is how we progress as human beings, as scientists, as researchers and health practitioners. We have to keep our mind open and should not just blindly accept everything. I continue to teach my students to always keep their mind open and do not accept everything that I say or others say, that they should use their own mind to decide what is correct, what makes sense to them. So, what are these three things? The number one complaint that the patients have, and I see this all the time, is that they cannot either find the osteopath or manual osteopath. In Canada we call manual osteopaths. In other part of the world, what we do, the professionals are called osteopaths. So we get confused sometimes between using the term osteopaths and manual osteopaths. The number one complaints patients have is that they cannot find a manual osteopath near them, or when they find, they cannot get an appointment. This is so because for a variety of reasons. First is because there are not so many manual osteopaths out there. In the province of Ontario in Canada, for example, there are 11,000 massage therapists, 11,000 physiotherapists, 5,000 chiropractors, over 10,000 acupuncturists, but about 1,000 manual osteopaths. And in many countries, there are not so many of them. Even inside Canada, up to 10 years ago, they didn't have manual osteopaths in Prince Edward Island, Newfoundland and Labrador, Yukon, Northwest Territories, Nunavut, and it is because of my school, National Academy of Osteopathy Canada, that which over half of the manual osteopaths in Canada are in English-speaking provinces of Canada are its graduates. Because of NAO, now these provinces have manual osteopaths working there. So even within Canada, there are so many regions and so many towns don't have access to this beautiful, wonderful, miraculous healthcare. And my goal is to ensure they have manual osteopath in them. This is my lifelong goal. Number two complaints that the patients have is that the services of manual osteopaths are expensive compared to other health professionals. Well, this is true. Manual osteopaths on average charge $80 to $100 per hour, but we have a lot who charge more. I have students who even charge $400 per hour. I have Dr. Lisa Egbuga in Toronto downtown who's charging $275 an hour. She has been chosen by Toronto Star newspaper, the largest Canadian newspaper, as the number one manual osteopath in Toronto. This is because of the laws of high demand. There are not so many manual osteopaths, and they do wonders in treating chronic pain. Most of the patients they see are last resort cases who had chronic musculoskeletal and joint related chronic pain for many years. And these manual osteopaths most of them are fully booked, as some of them even have 6 months to a year waiting list. So it is natural that they increase their prices because their services are high in demand. While it may look that their services are expensive, but you look at the total cost to the patient, it is actually low. While these patients, as I said, most of the patients of manual osteopaths are last resort cases, meaning they had treatment for years, many type of treatment that cost either to the patients or to the healthcare system thousands of dollars. While Average patients in Canada spends about $500 for osteopathic services, meaning that by spending $500, they recover from their disorders. So when you compare that, the $500 to thousands of dollars that the patient or the healthcare system spends, you see that the services is not expensive. Yes, per treatment fee is more expensive, but then in the total overall cost is less expensive. Number 3, and the last complaint that I want to speak with you today is that a lot of manual osteopaths who are not our graduates, they are known for using passive techniques, too many passive techniques in their treatment systems. We are a mechanical based, our school, my schools, the 3 schools, we teach the mechanical based system of osteopathy, the orthopedic style of osteopathy that focuses on hands-on manual therapy. While there are other schools that focus on the vitality-based osteopathy. In other videos, I explained the difference between vitality and mechanical-based systems of osteopathy. And in vitality-based, they focus more on the soft, passive techniques like cranial osteopathy, positional facilitated release technique, and so on, where the manual osteopath basically puts the hands on the patient and waits for a while, from a few seconds to a minute and a half, and so on, without doing anything. While we mechanical-based manual osteopaths, orthopedic style manual osteopaths, we also use passive techniques, but to a lesser extent. We also use cranial osteopathy, positional facilitated release technique, and other techniques that are soft, gentle, and low force, and basically they are called passive techniques, where manual osteopath just puts the hands on and waits for a few seconds. We focus more on a little bit of more strong techniques, active techniques, where the manual osteopath does work. I always tell my students what we do is manual therapy. Emphasis on the word manual, meaning you have to do work. You have to use your hands to modify things in the body. We are the biomechanics of the body. We are the engineers of the body, and you cannot really affect it so much by not getting in and dig it. And that has been shown by research to be more effective in treating pain. I give you an example. I have this student in Montreal, and she was a member of the Canada's national soccer team for females, and very good girl, very active girl. She's a good friend of mine now, and she treated this patient, Mark McNeil, a registered massage therapist in Montreal. Mark had shoulder pain, and he saw 5 Quebec osteopaths for his pain. Nobody could help him. Then he heard about Anne. And as I said, one of our students who studied online at National Academy of Osteopathy. And in one treatment, she fixed his shoulder pain, and this shocked Mark so much, he registered for the diploma in osteopathic manual practice we offer at National Academy of Osteopathy, and now he works with us at the osteopathic chronic pain clinics in Montreal. This is because we move everything. While most other manual osteopaths usually treat the patient for 30 minutes, our graduates treat the patients for 1 hour. We move everything. There is not one ligament, one muscle that is not stretched or moved or strengthened during our treatments. And this is why our graduates are so good in treating chronic pain. Success is not an accident. I founded Osteopathic Chronic Pain Clinics of Canada in 2017 from one clinic in Toronto. Now we have 333 clinics, and this is because of success in treating chronic pain. And this success is because of manual osteopaths who are doing great job in treating chronic pain. And that again is not an accident. They work. They do manual work. They stand 1 hour on their feet and they do their job. I give you another example. Tony Lee. He was a makeup artist for the movie industry before deciding to study at National Academy of Osteopathy. And the first job he got was in a rehab clinic in Markham, the rehab clinic owned by Dr. Raymond Chen, a family physician, and his wife. The first patient Tony saw was a patient who had a car accident 6 months before. This patient had chiropractic, physiotherapy, massage therapy, rehabilitation, and acupuncture in Dr. Chan's clinic. Pain subsidized a lot, but the patient still could not walk. Tony worked on this patient for 2 weeks, and the patient could walk. Can you imagine that? It's a miracle. What Tony did with his hands was miracle. I'm grateful to God for osteopathy because it's a miracle on a day-to-day basis that our students do. This shocked Dr. Chan so much, he and his wife registered at National Academy of Osteopathy, got the DOMP, then they registered into the Doctor of Osteopathy program at National University of Medical Sciences in Spain, and they don't even, now his wife practices manual osteopathy because Tony left the clinic, he opened his own clinic. You don't find so many manual osteopaths working for others. Maybe they work for a year or two, but they most end up doing their own clinic. So his wife is working in the clinic, and Dr. Raymond Chen, he's not working, but he just loves osteopathy so much, he decided to know as much as he can about it. This is the power of osteopathy and the power of orthopedic style, mechanical based osteopathy. I get a number of complaints from patients who are shocked when they come see our manual osteopaths, my students. We only hire my students. All manual osteopaths working in my clinics, osteopathic chronic pain clinics of Canada, they all my students who have taken a fellowship in chronic pain management, in osteopathic chronic pain management at National Academy of Osteopathy. We offered free of charge to them as a postgraduate program. And all of them are my students, and patients tell us they went to so and so manual osteopath, and all the manual osteopath did put their hands on their head, on their back, put their finger and hold it for 90 seconds, and they didn't understand why if they go with back pain, the manual osteopath puts the hand on the skull and so on. First of all, that's a failure of the manual osteopath to not explain the techniques. I teach over 200 business lessons to my students. That is why my students have 60,000 more in gross income than other manual osteopaths in Canada. My other manual osteopaths have an income of $90,000. My students have an income of $150,000 per year, and that is the reason we graduate successful manual osteopaths, because I teach them everything I know about business. And one of them is that, and this actually can make them fail the final exam. While they're doing every type of techniques, if they're doing osteoarticular technique, they must explain to patient what is this technique for in lay terms, in easy to understand terms. What is this technique, what it does for the patient, and what benefit it has. Then after that, if they're doing muscle energy technique, the same. Or like, hi John, now I'm doing muscle energy technique, this does so and so for you, and so on. So the patient, a patient who understands what you're doing, that patient refers others to you. A patient who does not understand what you do, he or she will not refer others, because if they ask him or she what the manual osteopath does for you, and if he cannot explain, he may feel shy and he will stop referring you. But once he knows what you're doing, then he refers others, and this is one way to get referrals from patients. That you have to explain what's the technique for and what it does, and then they understand why you're putting hands on the head for when they have back pain. I get tons of referrals. Even some of my students who before they study manual osteopathy, they saw other manual osteopaths, and they told me they didn't understand why the osteopath just put the hands on the head while they had other type of other body parts pain. This is because the manual osteopaths don't explain. They assume everybody knows what is cranial osteopathy, why we do what we do, while you have to explain. And it is okay if you do some of these techniques, but they should be just part of your treatment. Most of your treatment should be based on active types of techniques. Passive techniques are good and they have their places in a certain kind of cases, but to a limited degree. Not, of course, there was different cases. If you have patients who suffer from concussion, and that obviously cranial osteopathy, the passive type of techniques are indicated for that. It's very good. But I'm talking about general things, and general things, 80% of the cases, what patients see a manual osteopath for is chronic low back pain. So for those general things, you should consider active, hands-on, moving techniques to move the structure of the body. I strongly believe that the structure governs function, and by changing the structure you can change the function of the body, but that requires you as an engineer to get in there and move things. Just putting hands on the hands on one part is fine, but not if it's all 1 hour of your treatment is that. That's it for today. I hope wherever you are, you have a wonderful day. Enjoy this beautiful day. I love it. Sounds of birds singing, the winds playing music for me. When the leaves move, the leaves of the trees, they sing such beautiful songs for me. I am blessed. I am truly blessed to see all this beauty. Thank you, God. I am blessed. Wow, look at the wind. You hear? It's a beautiful world. It's a beautiful world. I love you. Thank you for watching this video. I pray for you wherever you are to have a happy, healthy day, and please take care of yourself. Please be positive. Enjoy this life. Until next time, bye for now. God bless. Namaste.